My name is Yasser Kawar. I'm a pulmonologist at the Goshen Health Center. I did my undergrad overseas in Jordan, and that's where I did my med school. After that, I did my residency in internal medicine at Henry Ford Hospital in Detroit. I continued my training with pulmonary and critical care at the same hospital, Henry Ford Hospital in Detroit, Michigan. The reason I chose pulmonary critical care, because when I did my rotation during my internal medicine training, I did like the variety of the disease and taking care of different types of patients. I also like doing procedures within pulmonary, such as bronchoscopy. I do bronchoscopy and bronchoscopy for airway exam. We do bronchoalveolar lavage with the bronchoscopy. Also, we do more advanced procedures, such as EBUS, which is endobronchial ultrasound. We do use it to stage lung cancer and biopsy different lymph nodes in the lung or different lymph nodes in the chest. We're always available and happy to see different patients. They could have asthma, COPD, or even they have a lung nodule that's concerning for cancer. I do also see patients in the hospital as an inpatient setting, and most of those patients, they do have underlying pulmonary disease. I would really encourage primary care physicians to refer patients with obstructive lung disease. For the ones who have symptoms of shortness of breath and those symptoms are uncontrolled despite using all different types of treatment in the primary care setting. If patient needs lung cancer staging, or if the patient has enlarged lymph nodes in the mediastinum, those patients would be appropriate to be referred to us in order to obtain required biopsies. With the new guidelines for lung cancer screening, it's recommended that patients between the age of 50 and 80 to get a low-dose lung cancer screening CT scan on an annual basis. This is done for patients with the age group of 50 to 80 and who have a history of smoking of 20 pack a year or more, or they have quit smoking within the past 15 years. Once their primary care physician finds any concerning finding with those CAT scans, they need to be referred to us so we can start with the diagnosis and management of those patients. So for new patients that we see in clinic, we really would like to have a two-view chest x-ray and a pulmonary function test in order to know exactly the underlying reason for their shortness of breath and know the exact severity of what's going on. A special thing about our cancer center is that we do meet on weekly basis during Tumor Board, where the team, including us, pulmonary, surgical oncology, medical oncology, radiation oncology, and other team members, where we would discuss patient care and what's the next best step to offer for our patients in order to ensure the best outcome.